Hi.
Hello.
We're doing an interview right now, and right now it's been about, what, 6 or 8 weeks since you started care?
Yes.
Um, and the condition you were seeing us for is a thyroid condition that's been going on for about 20 years, right?
Yes.
And initially, when you had the thyroid condition, some of the symptoms that you have been experiencing over the last 15 or 20 years, and you've had bouts of being unable to drive. It's affected your emotions. It's caused some severe depression. Can you elaborate on any of those things for me?
Sure. Sometimes I would just be so exhausted. I would sit down and within 30 seconds I'd just fall asleep anywhere. There were several occasions when I was driving where I dozed off for momentarily and woke back up. Thank goodness. Um, just chronic fatigue. My muscles would feel so sore that just someone just touching my arm, it would actually hurt. I was getting swelling in my my ankles and feet, lower legs, depressed, just physically just feeling terrible.
And then you presented yourself into our office. You were taking Synthroid.
Yes.
And that had been going on for 20 years, right?
Pretty close to 20 years, and initially it seemed to be effective, but gradually over the last couple years, it seemed to be less and less effective. And this past, I guess about the last 6 months before I came to see you, I was actually getting to the point where I was almost as bad as I was almost 20 years ago when I got diagnosed.
Right. And when you first came in, you had quite a bit of pitting edema in your ankles.
Yes.
You had some swelling. You were gaining weight, and your level of joy was not exactly so high, was it?
No, not at all.
And that had an effect on your relationship. It had an effect on your attitude. And what else?
Just my whole life in general. Just feeling depressed, almost having to force myself to move through the day. And by the time I would be able to get through the day, by evening, I mean, I was just totally worn out, and it was basically just getting through the day and sleeping and waking up still feeling exhausted.
And the way the doctors treated you in the past, they would run a blood test and just regulate your Synthroid function.
Yes.
Never treat your autoimmune condition, the Hashimoto, or any of your other conditions that were precipitating your thyroid misfunction.
No, nothing. The only thing is they gave me a mild diuretic to use PRN for the edema. But other than that, there was no other treatment except regulating the Synthroid.
And you're a healthcare worker or what?
Yes, I'm a registered nurse.
And going through the medical procedures, it got pretty frustrating, especially when you're a member of this system.
Yes, definitely. When you're feeling terrible and you're trying to explain to the doctor how you're feeling and nothing ever changes, it gets very, very, discouraging.
So what did Dr. Cohen do for you in his pain and thyroid clinic?
Well, looking at me as a entire individual, and since I've been coming here, gosh, I have more energy. I'm no longer taking the Synthroid at all, and I have so much more energy than I have for a long time. I have lost some weight. I have flexibility in my joints that I haven't had for a long time. I have no edema, no swelling whatsoever at all in my feet and lower legs.
How about your attitude?
Oh gosh, I'm actually so much more positive. My attitude has really improved. Most days I'm happy. Before then, it was really hard for me to feel happy.
Yeah, and even you were questioning even your job and being able to continue, right?
Oh, absolutely. I didn't think that I had the energy, and not only that is I can think so much better. I was getting to the point where I was having a hard time concentrating and thinking, and I noticed in the last few weeks, especially, I'm using the 50-cent words that I used to use before that I haven't used for a while, and so my brain is clearer.
And as a nurse, you know, brain fog is one of the cardinal signals of autoimmune thyroid,
Yes.
right?
Yeah.
And that's pretty scary because if your brain goes,
Mm. I'm really in trouble if my brain goes.
they're not employing you very much. So, what would you recommend other people to seek out care with an autoimmune thyroid or any autoimmune problem that has been causing them pain and disability?
Absolutely. I mean, you have to get to the root of the problem and not just medicate the symptoms. And many physicians out there are just medicating symptoms with medication and not really getting down to the real problem.
And are you taking any medication anymore at all?
The only thing I take is I take some medication for my high blood pressure, but it has been so much better that I've decreased it in half. And I take an over-the-counter allergy pill just for, the seasonal allergies. But other than that, no other medication.
So, you're not on any Synthroid or any thyroid medicine anymore?
No.
And how excited are you about that?
It's wonderful.
This is the first time in 20 years, right?
Yes.
So, God bless, right?
Absolutely.
Any other conditions that he helped you with in terms of your joints, your muscles, your nerves, or anything like that?
Yes, I have, since I've been 17, scoliosis. So I've suffered with, stiffness in my joints, pain, different areas of my body kind of going out of alignment. And I've just, over the years, had to deal with that. And
How much better are you now?
I haven't felt, and seriously, I'm 56, almost 57. I haven't felt this good for probably close to 20 years.
Well, I appreciate you giving us this recommendation, and thank you for expressing yourself.
Well, thank you. I appreciate everything.